Now, how did that transition happen? In his very eloquent, delivery on why the emergency ward, the red zone especially, sometimes get frustrated in dealing with emergencies that come to them, he made a statement I personally considered unfortunate. He talked about the lack of ventilators. He talked about the pressures they go through and the sacrifices that they make, which were very, very beautifully and eloquently, narrated to the minister. But along the line, he said he did not understand why this particular matter, referring to the recent death, was blown out of proportion.
Right.
That is when I stepped in and I appealed to him not to say that again because of the sensibilities of the families involved. And that he could go ahead to talk about their frustrations and the help that they will need to serve the people better without suggesting that one life lost is not enough to be blown out of proportion. I made the point strongly to him that one life lost is enough to be blown out of proportion so that measures will be taken to prevent other lives from being lost.
Right.
He wouldn't take that from me and insisted that we were not understanding him. At that point, and I want us all to, disabuse our minds of any bias and listen and watch the videos. At that point, the Minister of Health asked us to leave because he wouldn't take my advice that he should not say the matter is being blown out of proportion. But whilst we're walking away, his CEO asked him to stop talking, but he was still insisting that we were misunderstanding him and that he said nothing wrong by saying that the matter is blown out of proportion. That is when the minister turned back and said to him that, my brother, calm down. You see, we are supposed to be your superiors as Minister of Health. And if you will not even take this advice from us and you are insisting on your right this way, can you imagine what you will do to an ordinary citizen who comes there and wants to inquire about anything? And that is why I think there's a problem here, and that is why I'm here. And that is where it ended, and we walked away. And nothing has happened to that said doctor. We understand he's a very hardworking doctor. We understand he makes a lot of sacrifices in the course of the discharge of his duties. We appreciate that. And we think that should not lead him to forget about the sensibilities of the people. But even having said that, we do not expect any disciplinary measures to be taken against him because he was simply being assertive. But perhaps if he had taken our advice not to suggest that the matter is being blown out of proportion, we would not be here. But the decision to dismiss the CEO had nothing absolutely to do with that altercation. The decision to dismiss
is entirely different. The decision is entirely different from what happened yesterday.
Absolutely. The decision to dismiss the CEO is part of the ministry's decision, the part of ministry's program and agenda to, if you like, reset the hospital. We believe that it is not enough to remove the CEO, but subsequent measures are going to be taken. Look, as we speak with you, at least I can disclose that I know that the whole day today, the Minister of Health has been working to get some more ventilators, which I believe will be delivered to the hospital by, before the end of the week. I'm very confident about that.
There's not been any clarity as to even what exactly is the reason for which he's been sacked.
No, he gave us clarity. I asked him this question yesterday, the minister himself, from the horse's own mouth.
Yes.
He said, I sacked him because he was superintending over a rundown hospital with equipment that had been broken up for so long. He hadn't even attempted to try and find a fix for them. He definitely didn't.
Well, you see, we have heard different explanations on different media platforms. One was that there was negligence.
Oh, no. He clarified that. That I can tell you.
I'm coming.
The negligence that led to the death. He said that's not why he's been sacked.
I'm saying it started from there. And then subsequently, we've had a clarification, even this afternoon, engaging on your platform with Suhini. Honorable Suhini. He said there was managerial negligence. And then other people have said other things, that they've even moved parts of certain machines to go and repair certain other ones, etc. You see, it's not tidy. If this is done, there's no wrong in going to have a swooping check what is the real situations on the ground.
That's what he did.
But there is a place for having a more thorough and detailed approach to see what are the issues, what are some of the challenges. In some of the interviews, you saw clearly that the CEO was telling him that even some of the devices predated him and had not been working even when they were supplied. So there are issues to be dealt with. If you disaggregate them, then you can distill them properly so that even the new person coming in can then know where he must put emphasis.
Dr. Idrisu, you've emphasized the need for accurate and timely data to support economic planning. In practical terms, what immediate steps are you taking to strengthen Ghana's statistical system?
Good morning to you, and good morning to all your listeners. It's morning here, I guess it's afternoon.
It's afternoon here in Ghana, indeed, yes.
Yes, that's correct. So yeah, that's a very important question you've asked. And so what we are doing at the Ghana Statistical Service to actually ensure that we bring data to inform development and to make it the center for decision making for the economic transformation that the government is trying to pursue, is to make sure that we implement a very comprehensive modernization agenda to make our data system more real-time, responsive, and transparent with the support of some partners. I must say that we are implementing a number of initiatives which we believe would deliver the job. So, for example, we are looking at initiatives that is looking at digital data collection. So here we are moving away from paper-based surveys to computer-assisted data collection tools using tablet, mobile apps, GPS tracking, and this would definitely reduce the delays we usually would face when we are collecting data, and will improve accuracy as well. We're also looking at administrative data integration. We are working with ministries, departments, and agencies to improve the use of administrative data. And here we are looking at data including health records, tax filing systems, and school enrollment, which can be updated regularly and offer near real-time heights. At the same time, the statistics data portal we are developing is also helping us expand our online platforms to make data more easily accessible to all policymakers, researchers, journalists, and the general public. And we believe that open data is a smart data initiative to pursue. We are also looking at geospatial and big data innovations. And here we are supporting the whole system with exploring satellite data, mobile phone data, AI-based tools to supplement traditional surveys and provide faster, localized insights.
Right.
I must say, it's people who are working on all of these, and so we are also centering on capacity building and also building partnership to deliver what we need to do. So in short, I would say that we are transforming the Ghana Statistical Service into a real-time intelligence hub using digital tools, big data, and stronger partnership to deliver faster, more transparent, and accessible data for decision making.
Well, given Ghana's ongoing engagement with the IMF and the importance of fiscal discipline, how is Ghana Statistical Service ensuring integrity in the data you're talking about, especially in areas like public debt, inflation, and employment figures? Very briefly.
Well, this is a very important question you have asked. Credible data is a foundation of credible policy, as we know. So whether it is for IMF reviews or investor confidence or for local planning, the Ghana Statistical Service is actually committed to ensuring that Ghana's numbers are not just available, but they are trustworthy. And so at the service, we've put in place a robust system to ensure that data we produce, whether it's on inflation, whether it's on employment or other economic indicators, is accurate, independent, and timely. And here, we are very much focused on methodological rigor. So we follow international recognized standards, particularly those set by IMF.
Right.
And then we're also collaborating with key agencies to deliver the data. For example, with fiscal data and debt data, we collaborate with the Ministry of Finance to do just that. And then we also are using technology as we are digitalizing data collection and validation processes, reducing human error and increasing improving efficiency in terms of our data collection methodologies. For example, our labor force surveys now use computer assisted interviews for faster, more reliable data. And also, we are clothed with some independence to ensure that we operate independently, and our mandate is protected by, the Ghana Statistical Service Act. And so we publish our data regularly, make it accessible to all, whether they are policymakers, they are businesses, they are researchers, and then the public, so that our integrity can be judged by everyone.
Well, in light of the recent economic shocks, from global inflation to currency depreciation, how can robust statistical systems help Ghana anticipate and better manage such crises in the future?
Look, the truth is that you cannot manage what you can't measure. So robust statistical systems are early warning and navigation tools in times of crisis. And I think we all have to recognize that, this is very imperative. And here is how they help Ghana. So in terms of early detection, for example, with reliable inflation and trade statistics, we can detect rising global prices or currency pressures. And then we can take timely action to stabilize the economy.
Right.
And also, with regards to decision making, I must say that data would help policymakers weigh trade-offs. For example, whether we should adjust interest rates. Every now and then, the Bank of Ghana meets to take a decision on whether they should hike or they should relax the rates. And you need data to be able to do that. And so we work with key stakeholders, including the Bank of Ghana, to provide such data in granular manner. And then we also work to ensure that we provide data to support decision making at the firm level. Industry needs data to do their job. We expand social safety nets as well, and we know that good data leads to smart, targeted decisions. We are also working to ensure that the data that is produced is used in our social protection safety nets. For example, disaggregated data that we produce by income, by gender, by region, allows us to identify who is most affected, and then we'll be able to tailor support programs accordingly to reduce inequality during shocks.
Right.
I must say that the data would also support investor confidence.
Right.
Transparent, credible statistics that we build, that we produce, will build confidence among international investors and institutions. That's crucial for maintaining access to financing and also avoiding panic in the market.
Right.
And then it's also important for resilience planning. But in short, let me say that the data systems are not a luxury anymore. They are a lifeline. We must know that they help Ghana anticipate, absorb, and recover from shocks more effectively. And that's why part of the programs and the interventions that we are observing at the spring meeting is touching on all of those.
All right.
I must also say that robust statistics are Ghana's early warning systems, and they would really help us to navigate our way through addressing the shocks that face us globally today.
Great. Thank you so much, Dr. Idrisu.